Dumelang XF family, namhlanje silapha eMatchesfontein where we are joining KeReady Mobile Clinic. Now they offer you healthcare right at your doorstep, man. I'm super excited to find out more about the incredible work that they do within our communities, and they do so without any judgment. So without wasting any more time, Ashton Kon. Let us know how far, or rather how long has KeReady been operating?
Yeah, KeReady started during the arrival of the COVID in South Africa, and then the South African government were finding a challenge in terms of reaching more to the youth, and then they approached DGMT/KeReady to assist them to engage with youth so that they can get access to the COVID-19 vaccination. That's when we started, and then we're rolling out now the KeReady in the 4 provinces of South Africa: Eastern Cape, KZN, Western Cape, and Gauteng.
Now, how many mobile clinics does KeReady have?
KeReady is serving 46 mobile clinics, but in the context of Western Cape, we're having 9 mobile clinics: Eastern, Southern, Tygerberg, Northern, Western, Mishas Plain, Cedarburg, Khayelitsha. Yeah, those are the 9 KeReady mobile clinics in the context of Western Cape.
Sis Bungiwe, can you please let us know of some of the health services that you provide right here at KeReady?
Okay, the services that we offer, we usually offer them in this mobile that I'm sitting in. Okay, so the services, we do screenings for HIV, STI, TB, and then we test for HIV. If the person tests positive, we refer them to the nearest local clinics. And then we also do vaccinations, which comprises of the HPVs and measles campaigns, and also we do pap smears in this couch here, and then the results we send them to the clinic. Yeah, the clients will get them there.
Dr. Letu, now KeReady is not your conventional, clinic, because what we're used to is going into a physical clinic, but now you have a mobile clinic. What inspired you to be a part of this amazing initiative?
Thanks for that, Christian. It's brilliant. I think what really drew me to working with KeReady, it's because it's for young people and it's by young people. So we have young doctors, young nurses, mobilizers, communicators like myself going out into communities, and we reach young people where they are. And that's the convenience of having a mobile clinic, right? And we're offering youth-friendly services. So, sometimes in South Africa, a lot of our clinics and hospitals, we struggle to create environments where young people feel very comfortable, right? So our mobile is cool. We have Wi-Fi password over there. We play some cool music. It's young, it's friendly. We don't use any jargon. It's a judgment-free space. So it's an environment where young people feel really comfortable and they're able to open up because we can really relate to them.
You provide health services to people that come into the clinic, but of course we want to know, how else do you ensure that your patients get information that might be vital to them?
So we provide non-jargon healthcare information on all digital platforms. We are active on Instagram, Facebook, X and TikTok, and you can also connect to a doctor. You can ask us any medical related questions that you have, or even just chat to us on our WhatsApp line, which is 060 019 0000. Let's chat on WhatsApp.
Melissa, thank you so much for taking time to talk to us today. Let us know, how does KeReady Mobile Clinic make it easier for you to access healthcare facilities?
So KeReady Mobile is actually an important organization. It actually comes to you and they're not judgeful. Because when you go to the clinic, they'll be like, hey, what do you want here? You're young to want, and this generation of today actually thinks, but let's say, for example, I go to the clinic, they're going to think I'm here for testing, pregnancy tests and stuff like that. They start judging.
Mobile clinics such as KeReady are very important within our communities. Why is that?
KeReady brings primary healthcare services to underserved communities. So because I'm part of one of these communities, I know what it's like not to be able to access healthcare services. So, and because we bring mobilizers with us, it's easier for the youth in our communities to relate to them, these mobilizers, and for us as mobilizers to encourage them to make use of the primary healthcare services. So they no longer have to worry about having to queue for long in a day hospital queue, or having to get up early, or by getting the wrong response when they go to the clinic, especially females or young girls in our communities. I know what it's like to go to a clinic, to go ask for family planning and get the response that, why, you're too young, what do you want to do with it? When you come to our KeReady mobile clinics, you don't get a response like that. You get information for you to make an informed decision. So yes, it plays a very important role in our communities.
All right, Zibi, so I want to find out from you, have you been to the clinic recently? If you do go to the clinic, how often do you go to the clinic?
Qedetse kgalo ya clinic ke sena ke le monyenyane, so I don't usually go to the clinic because ke dutse ke le grand, ke dutse ke le sharp.
How often do you go to the clinic? Do you ever go to the clinic?
Not quite often. I prefer to go to doctors just because of the convenience of having to just set up an appointment and show up at that specific time. But otherwise, no clinic.
Lumango, we want to find out from you, have you gone to the clinic recently? How often do you go to the clinic if you do?
Nah, recently I haven't went to the clinic, but I usually go maybe once in 6 months, something like that.
Now, KeReady is truly amazing, making sure that they are providing health services to everyone across South Africa, also creating a space where they are able to feel free without being judged, and also to share some of the issues that they are facing. Now, as you guys seen, we're going to be moved from Fontaine, Lana Manchester, Lana CPUT in Bellville to ensure that we are continuing to provide our health services across the whole of Cape Town. Thank you so much to KeReady for having us today. But unfortunately, that is all that we have time for. Let's take it back to studio.